I'd like to welcome you to Beckett Springs. Whether this is your first admission or you have had previous admissions here or elsewhere, we are glad you came. We understand that this is a difficult time for you, and we want to make your stay as comfortable as possible. Most importantly, help is here, and recovery is possible. Starting today, you'll meet members of your treatment team, a physician or a nurse practitioner, a social worker or chemical dependency counselor, recreation therapist, as well as registered nurses and patient care assistants. You'll have a physical by an internal medicine physician to make sure we are treating all of your physical and psychiatric needs. You, along with your treatment team, will decide on your treatment goals. These may include things like returning to work or school or maintaining sobriety. Your therapist, also known as a social worker or counselor, will review your written treatment plan with you and discuss any questions or concerns you may have. Your psychiatrist or nurse practitioner will determine a medication regimen that is unique to your needs. Nurses will administer these medications within the safety guidelines determined by the FDA, the medical staff, and the pharmacist. If you have questions about your medications, please discuss them with your treatment team.
Safety is of the utmost importance to us. When you are admitted, we conduct a thorough search of you and your belongings so that everything brought on the unit is considered safe. This is done with great respect to your privacy and any past traumatic experiences. Any item that we feel is unsafe will be locked away or sent home with family until you are discharged. While this can be frustrating at times, we do this so that we can maintain a basic level of safety among all patients. Items that we must confiscate on admission include, but are not limited to, cigarette lighters, belts, shoelaces, and toiletries that include sharp edges or contain alcohol. You may be able to check some of these items out during limited times on the unit and use with supervision. Patient care assistants like me conduct rounds on a regular basis to assure that you and other patients are safe. You may see one of us around the unit checking in with you and others. We're here to help you. Because we know that it can be overwhelming to make many life changes at once, we do allow smoking at Beckett Springs. Staff members monitor the smoking time, handing out lighters and cigarettes when there are smoke breaks. Smoking times occur at 6 predetermined intervals throughout the day. If you are a voluntary patient, you may go outside during these times and smoke. Your recovery is primarily based upon the work you will do in groups. Smoking schedules cannot be altered as they are timed around the dense and fulfilling group schedule here at Beckett Springs.
Our average length of stay is about 8 to 9 days. Rarely is a patient discharged in just a few days, as a crisis situation often takes time to stabilize. The most successful patients remember to take recovery one day at a time. During your stay, you will be invited to participate in the therapeutic groups that we offer, which can really help on your journey to recovery. The most successful patients take advantage of the many treatment options available to them. Our caring team is trained to meet your needs throughout your stay.
At Beckett Springs, we take your rights as a patient seriously. The state of Ohio provides protection and guidance to patients and providers in a hospital setting. The focus is always on your safety and well-being. Your treatment team will work closely with you every step of the way to inform and educate you about these guidelines.
At the time of discharge, you'll be asked to complete paperwork, including a patient satisfaction survey. We strive to score a perfect 10. In order to do so, we need to hear from you during your stay. Let us know what would keep you from giving us a 10 so we can improve your experience while you are here. Your feedback is very important. We use it to provide you with the best care possible.
Your success in recovery is highly dependent on your plans after discharge. Our interdisciplinary team works to assure that you have the comprehensive, unique plan you need. With your permission, they may involve your family or other loved ones to support you in your recovery. Your therapist will work closely with you and your family to finalize your plans upon discharge and will answer any questions about your next steps. We realize this is a lot of information that may be difficult to remember. Your team members will be happy to answer any questions you have along the way. We have nursing and PCA staff here 24 hours a day. Most importantly, We want you to focus on yourself and your recovery. No matter how dire your situation may seem, we know you can do it. We are glad you're here. There's hope. There's help. There's Beckett Springs.